Okay po, 1 o'clock na, so let's begin. Magandang hapon po. We welcome you to the fourth edition of this webinar series, Rising to the Challenge. Using green slides. Rising to the Challenge of the Pandemic, LGU Best Practices in COVID-19 Crisis Management. This webinar is brought to you by the Center for Local and Regional Governance of UP and CPAG in partnership with the League of Vice Governors of the Philippines. For those joining us for the first time, the Center is a public service unit of the University of the Philippines that was created to assist local governments and local government stakeholders through research, training, and consulting. We have been following this mandate since the Center's establishment since 1965, and it is currently being led by our director, Professor Alicia B. Celestino. In the spirit of digital transformation, we bring this discussion to you online. This series not only serves as a platform for local leaders to share their COVID response experiences, but also as a means for you to share and discuss your ideas with one another as we collaborate and look for ways to overcome this pandemic together. My name is Gerard, a researcher at CLRG, and I will be your MC this afternoon. Joining me in providing this webinar experience are my fellow researchers, Ms. Selly, Ma'am Lou, Ma'am Marie, Ma'am Anne, Ms. Becky, Ms. Patty, and Sir Maki. Should you have any technical concerns during this webinar, please feel free to ask them through the Zoom chat box below. Before we begin, let me just remind people of some protocols that we have to follow during this afternoon to make the conversation more controlled and more easygoing for all of us. So we ask that each participant keep their microphones and webcams off to prevent interrupting the presentation. This meeting is also being recorded for documentation purposes. And lastly, certificates and the presentations will be given to participants who completed 70% of the total webinar time and submitted the feedback form after the webinar. And so there you go. Basta po you can attend 70% of this webinar time, we will be emailing you presentations and your certificates. As of today po, over 110 people have registered to join this webinar, and the people that have come here are mostly students and local government officials. Okay. At any point during the speaker's presentations po, if you have any questions, you may send your questions via the chat box in this format. So, pakibigay po ang inyong full name, yung institutional affiliation nyo, tapos i-type nyo po yung question nyo. We will try to answer these questions during the open forum. All right. So, to try and give you an overview po, our program will first begin with an opening message from the Dean of NCPAG, Professor Dan A. Sagil. His message will be followed by Attorney Catherine C. Agapay, the Vice President of Laguna and National President of the LGBT. Then we will move to the presentation proper. I will be the one moderating the session in the open forum, and I will try my best to ensure that we have a fruitful discussion this afternoon. Our webinar today has 3 speakers and is planned to go on for about an hour and 30 minutes. They are Vice Governor Mei-Ling M. Quezon from the province of Siquijor, Vice Mayor Alfredo M. Coro III from the municipality of Del Carmen, Surigao del Norte, and Mayor Ruben B. Corpus from the municipality of Jordan, Limaras. Their presentations will last up to 20 minutes each, and they will then be followed by a 20-minute reaction slides from the Honorable Maria Carmen S. Zamora, Vice Governor of Davao de Oro. To inform the speakers po na they have 2 minutes left, magkagawa po ako ng gentle reminder to them na there are 2 minutes left in order to ensure that time is kept na 20 minutes po yung presentations. Okay. After the reaction po, we will have an open forum where we answer some of the questions that you've sent to us prior through the registration form that we have sent you. At any time, again, paulit lang po, at any time during the presentation, feel free to type any question you may have. And kung meron pa pong questions na feeling namin kailangan i-tackle, we will tackle them during the open forum. On behalf of the center, after the open forum, I will be then presenting the certificates of appreciation to our speakers who have graciously given us their time to speak today. Lastly, oops. Lastly po, our director, Professor Alicia B. Celestino, will then finally give her closing remarks to formally end the session. And I will then be giving some final reminders to submit the feedback form so that you may get your certificates and a copy of the presentations. So without further delay, may I kindly request our Dean, Professor Dan A. Sagil, to give us his opening message.
Thank you very much, Gerard. Magandang hapon po sa ating lahat. Welcome po to this fourth edition of the webinar on rising to the challenge of the pandemic, LGU best practices in COVID-19 crisis management. I would like to start by wishing you and your families my best for your health and safety in this time of COVID-19. I would also like to express my gratitude to the officers and members of the League of Vice Governors of the Philippines and the director and staff of the Center for Local and Regional Governance for hosting this event. I am very happy for your continuous hosting of this exercise to share knowledge and experiences in managing public concerns at the local level. COVID-19 continue its disruption of or the threat to the operations of organizations from family to businesses. Many businesses have already indicated they could not continue their operations if another round of stricter quarantine is enforced. Entrepreneurs are facing many obstacles, including ensuring the business they put their blood, sweat, tears into continue to stay afloat. On top of that, many of them have employees that they are trying to protect and reassure, a difficult task when they themselves are struggling with burnout. And this is very unsettling. A crisis like this requires quick thinking in the face of uncertainty. However, with such high stakes on the line, we find ourselves dealing with analysis paralysis or the inability to make decisions due to overthinking. Delaying decisions will only lead to more problems, and those problems will require more decisions. Decisions in this kind of situation are never final, for the simple fact that change is never absolute. The knowledge and experiences we will learn from others help us make well-informed decisions about policies, progress, and projects by putting the best available evidence. This approach stands in contrast to opinion-based policy, which relies heavily on either the selective use of evidence, like using single studies, irrespective of quality, or on the untested views of individuals or groups, often inspired by ideological standpoints, prejudices, or speculation. Fortunately for us today, we have resource speakers. We have first-hand information and experience in managing COVID-19 in their respective areas. Using what they've already learned and created can save a lot of time and resources, increase our productivity, and minimize risk. We hope that this exercise will be effective in sharing information to support and promote COVID-19 response by generating relevant and up-to-date information. I am certain that CLRG is more than willing to provide assistance to you. I sincerely hope that the lessons learned in this webinar will assist all of us as we address the COVID-19 scourge. Before concluding, allow me to thank Attorney Catherine Kaagapay, Vice Governor Mailing Quezon, Vice Mayor Alfredo Coro, Mayor Ruben B. Corpus, and the Honorable Maria Carmen Zamora for their participation in this webinar and generosity in sharing their experiences and insights in COVID-19 management. And to all of you, thank you for your interest. I trust that you would find this exercise to be a rewarding experience. Maraming salamat po at magandang hapon sa ating lahat.
Okay po, thank you, Dean, for that wonderful message. Thank you po for reminding us that we have, when moving forward in this pandemic that has challenged the country, we have to try to focus on an evidence-based approach. So with that po, I would like to show yung video ni Attorney si Agapay that she has provided us prior to this webinar. So sandali lang po.
Thank you, Gerard. To our very own LVGP Regional Director, Vice Governor Mayling Quezon of Siquijor, LVGP Vice President for Finance, Vice Governor Maria Carmen Zamora of Davao de Oro, Mayor Ruben Corpus of Jordan Guimaras, Vice Mayor Alfredo Cora II of Del Carmen, Surigao del Norte, Professor Alicia Celestino, and to all our local officials, employees, and partners in government who are present this afternoon to listen and learn from the discussion. A pleasant afternoon to everyone. Allow me to thank my alma mater, the University of the Philippines, especially the NCPAG CLRG through Dean Dan Sagil, for partnering with the LVGP in reaching out and enabling LGUs nationwide to be equipped with the essential knowledge to wade successfully through this ongoing pandemic. As President of the LVGP and Vice Governor of Laguna, we again started 2021 with a lot of hope and plans, especially that the vaccines are coming in. But as a matter of necessity, we had to quickly change gears again this March to adapt and survive the COVID-19 pandemic. We have never experienced a crisis of this magnitude, and no one was prepared to deal with the rapid increase in infection that swept through our towns and cities. Some LGUs fared better than others, and this is the reason why we continue to reach out and dialogue with those who, in a matter of speaking, successfully initiated their emergency protocols in managing this pandemic. To learn from them and to make their experiences a blueprint in our continuing efforts to contain and bounce back from the immense impact of this worldwide health crisis. Together, let us listen to our speakers this afternoon, who will share with us their own experiences and to provide us with helpful insights. May we translate them into actions that will benefit our respective local government units, particularly the disadvantaged sectors. Once again, maganda at ligtas na hapon po sa ating lahat. God bless po!
Okay. So thank you po, Attorney Agapay, for that message. God bless us nga po sana as we move forward with this pandemic. And with that, the moment that you've all been waiting for, we can now begin with the presentations. I would like to now give the floor over to Vice Governor Mayling Quezon from the...
Hello, good afternoon po everyone.
Thank you po.
Good afternoon po, sir, to all the participants. First of all, we would like to extend our humble gratitude for choosing Siquijor to share our experience regarding COVID management to be chosen. I am designated by the governor to present to you the experience of Siquijor in handling the COVID situation. Leaders are expected to take on the challenge to lead. And with the COVID pandemic, it really has put the leadership skills of all leaders in the Philippines, because this is the first time that we encounter this kind of pandemic and this kind of challenge in a global scale, on a global scale. And we have never experienced in our lifetime, in my lifetime, in our lifetime, this kind of pandemic that has affected the whole world. So I would present to you the brief couple of slides in how the Siquijor province managed COVID-19. Siquijor, as of today, as of March 22, 2021, wherein the data has been compiled, the total number of confirmed positive COVID-19 cases in the province of Siquijor is 58. As of date March 22, we have 4 active cases. Out of 58 cases, 52 have recovered, and there are 2 deaths. Challenges that we encountered, first and foremost, the uncoordinated arrivals of our LSIs, the lack of manpower and frontliners, the lack of quarantine facilities. There was a situation wherein one quarantined person escaped from the quarantine facility. There were also concern of inadequate isolation and containment area for symptomatic COVID-19 patients. There was a concern for community and local transmission, and one of the concerns also was the numerous number of locally stranded individuals, particularly in the province of Cebu, when the outbreak started in March. So I would like to share with you some of the strategies and approaches adopted in managing the health crisis. The first thing we did that was, I would say, really made difference or an impact was the early action and creation of Siquijor COVID Interagency Task Force. We convened as when there was news already of the outbreak of COVID. We convened the Executive Order 2020-003 was released by Governor Saldivilla. Instituting the 2019 NCOV task force in the province of Siquijor, wherein I was designated as a Siquijor Incident Commander, with the Provincial Health Office as the lead office. So it started as early as it was formulated, the executive order was issued on the 2nd day of February 2020. So if you look at the timeline, even prior to the proclamation of the national state of emergency and lockdown of the national government, we in the province of Siquijor already have our own task force as early as February 2, 2020. And then soon after that, there was a series of executive order. We locked down our port as of March 17, 2020. So there was also a strict monitoring of arrivals in our port of entry. And there was a strict early closure of our port. We also instituted strict implementation of minimum public health protocol. We also conducted intensive IEC campaign regarding COVID-19 as soon as it broke out, as early as March. We give out flyers and pamphlets. We also instituted a uniform protocol for all LGUs, the 6 towns in Siquijor province. And we have coordinated with the regional and national interagency task force with regard to our protocols. I will elaborate on that later. There were 3 particular instances wherein we have been very, I would say, special, Siquijor province. And then we continuously conduct task force meetings every 2 to 3 weeks. We conduct meetings to assess and monitor the LGU situation. As I've said earlier, the early sealing of the port of entry. We also partnered with private resorts to be used as temporary quarantine facility. Those are the measures that we conducted, no, to manage the COVID-19. We also gave cash assistance to stranded Siquijodnons in Cebu City. We also gave, the province also gave counterpart funds to OFW for OFW facility quarantine per LGU. So the province would allocated money from its own funds for quarantine facility payment because we are using the resorts as facility for the OFWs. We also extended assistance to vulnerable sectors, the informal economy. We also created a sub-task group, specifically the sub-task group on the management of returning OFW and LSI. We hired additional health personnel at special rates because one of the challenges we faced was the lack of manpower. So we hired registered nurses, underboard nurses, and licensed and unlicensed midwives on a contract of service to supplement our manpower, and we assigned them to help in the disaster office, in the IPHO office. And we also use government facilities as additional quarantine facility. The province of Siquijor has a resort, Salagdoong Beach Resort. We converted it into a quarantine facility. Even up to now, we still being used as a quarantine facility. And of course, the manpower centers, daycare centers of the LGUs are used as a quarantine facility. The 6 towns are also asked to prepare their own quarantine facilities, and we purchased test kits from our, we received from the Bayanihan Fund, and we also allocated from our provincial funds. We coordinated with neighboring provinces for entry protocols. We have a very good relationship with the provinces of Negros and Cebu. And we also formulated the COVID-19 contingency plan and presentation to the task force. So these were all done during the period of March till December 2020. We asked the members of the task force, the contingency plan committee, to prepare and present to the task force the plans. And the specific strategies that we adopted that I would say make Siquijor very unique is that one of the issues that is common being an island is the entry of LSIs. So what we did was we sent letters to Coast Guard Central Visayas and the airlines, Cebu Pacific and Philippine Airlines, and the other shipping lines like Togo, asking them to, giving them a copy of our executive order and asking them to follow
Ma'am, are you there po?
While the boat are in transit or en route, so we know already who are the passengers. But even before that, in order to come to the island, they have to get coordination permit and acceptance and certificate of availability of quarantine facilities. So we know already who's coming. And then there were 3 instances that we asked the regional interagency task force to give exemptions to Siquijor 2 times in August and December 2020, wherein we temporarily suspend the inbound travel of locally LSI via land, sea, or air, wherein we totally closed off Siquijor. We closed off Siquijor from local air and sea travel. And the 3rd instance, aside from the closure of the port and closure of Siquijor, there was, if you could remember, there was guidelines from the national IATF to allow uppers to enter your LGUs without subjecting them to a 14-day quarantine. So our appeal was to limit the uppers who are exempted from the quarantine to only healthcare workers. Other uppers, we still had them undergo the 14-day strict quarantine period. So we were very strict. And we created a protocol system to transport our LSI from Cebu, wherein all of them are registered in our database system online, scheduled their arrival by batch according to the available quarantine facility of the receiving LGU. All of the LSI that were held in Cebu, because the bulk of our LSI when the island closed its port is coming from Cebu. All of them were contained in a quarantine facility prepared by the congressman, and they all had to undergo PCR swab test before traveling and allowed entry into Siquijor province. The swab test is shouldered by the provincial government. It's free. And then only those who tested negative will be transported from the facility to Cebu Port, allowed to enter the province. The results generated from the effective implementation of such management strategies is that out of 6,500 arrivals, we only have 58 recorded cases of COVID-19 positive patients, including those cases recorded during local and community transmission. We actually don't have that many local and community transmission. Most of these 58, 56 of this is coming from LSIs. The success factors that facilitated the achievement of the LGU management goals, I would say, is first, there was a strong testing and quarantine protocols of all incoming arrivals. We were very strict that everybody has to be tested, everybody has to be quarantined. We also had a very strong spirit of bayanihan. All 6 LGUs supported a unified protocol. So the protocol of the province is the one that is followed in all 6 LGUs. We limited access to the island. Since there's only 2 ports in Siquijor, the ports of Siquijor and Larena, this geographical, I would say, barrier of entry to the island is a very strong factor to the success of the containment of COVID in the island. The cooperation among the Siquijodnons, the proper coordination to regional and national IATF, and of course, the very strong leadership of our governor, Governor Saldi Villa, because even if there was a lot of opposition and pressure from other sectors to open up, we did not rush into opening the island, but we took our strict precautionary measures before we slowly open up. The remaining challenges, as of date, we still have no RT-PCR machine. We have no clear economic recovery plan, inadequate testing facility. We have lack of medical equipment to handle positive cases because we currently don't have any ventilator and other medical equipment. We have a rising case of suicide in the island because I think the mental health aspect also of the people, especially the youth, is of concern. The rising prices of basic commodities. There are issues now that we have opened up the island to tourists. There was a recent incident of people coming into the island who have fake swab test results. And we have inadequate isolation quarantine facility in case that the positive cases would increase. So we don't have a lot of room for that. Living under the new normal, there are a couple of plans that we have identified. First is the vaccination for all Siquijodnons. We are in the process. As of now, we have about 3,000 vaccines. We encourage our people to follow the DOH DIDA solutions such as wearing of face masks and observe social distancing, the public health protocol. We have formulated a COVID ordinance and we are enforcing the implementation of said ordinance. and the adoption of new normal rules that we are encouraging all the public sector and the government also offices to formulate their own new normal procedures and protocols in their workplace, such as social distancing, wearing a face mask, putting up plastic barriers between cashier and the paying public, uh, and all such said protocol. And that's it. Thank you and God bless us all.
Okay. Thank you, ma'am. Adjust lang po ako ng videos. Hindi po, technical difficulties on my end. Currently, slide, screen share. Ma'am, could you please pause your screen share po? Yes. Okay. So, before we move on po to Vice Mayor Alfredo M. Coro, synthesize lang po ako some thoughts that I felt were very good in your presentation po. Now, despite the challenges that happened that you were facing there in Siquijor, na yun nga po, may pagkukulang sa facilities, tapos there are a lot of things that were missing, you managed to successfully mitigate the damage that COVID can cause from 6,500 potential problems, naging 65 na lang po. And I do agree that the spirit of bayanihan and strong leadership has carried Siquijor into having such a successful result. Thank you, ma'am, for sharing. Now I would like to give the floor to Vice Mayor Alfredo Coro III, from Del Carmen, Surigao del Norte, to give his presentation and the strategies that they have employed in facing COVID-19. Sir?
Good afternoon, everyone. My apologies, I could not turn on my cam because internet is not that good. It might fall off. To Professor Ali Celestino, Mayor Ruben Corpus, Vice Governor Mayling Quezon, Vice Governor Maria Carmen Zamora, to our very own Honorable Mayor Baby Coro, my mayor, fellow public servants, ladies and gentlemen, marajao na hapon sa ato tanan. It is my distinct honor to share with you our ongoing story and experience in the COVID-19 health crisis management. Again, I am Alfredo Coro II, Vice Mayor of Del Carmen and Municipal IATF Chair, and concurrently supporting the Siargao IATF and the Provincial IATF, especially during the early phase of the pandemic. Next slide, sir. Our agenda this afternoon will cover a situationer of Del Carmen and Siargao, strategies for managing the health crisis, results and outcomes, the success factors and lessons learned, and moving forward. Next, please. In terms of the situationer, next, please. Del Carmen is one of the 9 municipalities of Siargao Islands, the 2019 #1 island in the world per Condé Nast. We are considered a geographically isolated and disadvantaged area, but it did not stop us from pursuing reforms to transform our community. Next, please. Let me first take you to Siargao Islands.
Sandali lang po, lagay ko po yung video. Share. Share ko po ulit.
Thank you, Sir Gerard. Next slide po. As of today, Del Carmen has 0 deaths, and Siargao Islands as a whole has 0 active cases. So yan po ang snapshot of our situationer. Pasensya na, it's March 17. Had to send the slides early. Next, please. The challenges encountered in the management of COVID, it's basically in 2 factors. One is policy and capacity. The other one is human behavior. In terms of policy and capacity, it's about human resources and policy support in the conduct of border control, especially that we have the Siargao Domestic Airport in Del Carmen, the seaport of Del Carmen, and the intermunicipal land borders. We have no hospital capacity to handle testing and care management, and the restriction of people seeking health care, like dialysis and maternal care, is giving us some issues before. In terms of human behavior, there's the issue of no mobility and stay-at-home order. Most of the marginalized have very limited home space. Second is about health-seeking behavior. People are stigmatized to report symptoms of other health cases. So in terms of, next slide please. In terms of policy and capacity, if we break it down, healthcare facility, as a geographically isolated and disadvantaged area, our patient referral requires transport from Del Carmen or Siargao Island to the mainland of Surigao del Norte, which is over 60 kilometers of open sea facing the Pacific. And secondly, we don't have testing capacity at the time. In terms of border management facility, we have to deal with foreigners and investors during the lockdown, and we had to do a lot of repatriation procedures from the Siargao Domestic Airport. The lockdown of ports also meant lockdown of supplies much needed by the island. Next, please. In terms of human behavior, the limited mobility or the stay-at-home order, again, is limiting the capacity of the families and their need to find food to feed the family. With no school, how do we start managing children and families at home? Every day, it's a different challenge for the families. In terms of health-seeking behavior, people were stigmatized to report symptoms that are not related to COVID. In terms of mental health management, as our good vice governors reported earlier, Del Carmen experienced 3 suicides, 2 of which are youth, and 1 professional that is now recovering from a breakdown. Next, please. So what are our strategies in managing the health crisis? First is to identify our goal. Immediately, when there was a possible risk of pandemic, there was only one goal we had in mind, that is 0 death. Next, please. So what were the possible obstacles to our target of 0 death? Number 1, there was no playbook on managing highly communicable virus, meaning ever-changing policy of government. So you have to understand that there has to be an ever-changing policy, and that communication is very necessary. Second, no clear science, means several misinformation, especially in social media, resulting to unnecessary fear and questionable behavior. Next, please. So what were our strategies? Number 1 was quick policy responses. In terms of policy development, all of our actions and decisions were based on policies that were done based on the science we can hold on to. Kung anong mahawakan na siyensya, yun na. Walang analysis paralysis, sabi ni Dean kanina. Organizational structure, we immediately set up the Incident Command System organization that will manage and implement the policy as early as February, similar to Siquijor. In terms of financial resources, we immediately aligned budget so that we can prepare for at least 6 to 8 months of response. And in terms of information and management education campaign, we did massive information campaign of the policies using whatever means to reach the last mile. Ginamit na nga namin yung nakasakay sa tricycle na may trompa, old school na pagkakampanya, just to make sure that every person would understand what we're dealing with. Next, please. Strategy number 2 is about hunger management. We provide weekly subsidy to the barangay from March 2020 to September 2020. Enough time for our constituency to grow their own food, to achieve food security, and fish for their own food as well. The social amelioration from the national government was meant to reduce cost allocated for food. So we also provided our own amelioration for medical and otherwise burial support. And in terms of reducing the cost of healthcare, para matanggal din yung stigma nila in terms of reporting non-COVID cases, we launched the Siargao Telemed program with the province of Surigao del Norte to allow continued access to healthcare despite limited mobility. Number 3, in terms of economic support, we launched the mobile tabuan or wholesale market operated by the local government initially to bring goods from one barangay to another. So para siyang barter system. In terms of fish access to market, we agreed with the mainland LGUs to allow market access protocol for fish suppliers. So tuloy-tuloy yung negosyo nila. In terms of tourism, we had early opening of our tourism destinations. As early as June 2020, we already launched the Sugba Lagoon tourism program. In terms of construction and the laborers of our construction, we never stopped construction work. Even during the ECQ, we allowed construction to continue. In terms of our transport sector, we launched the public logistics program in partnership with the online sales initiative under the Carmen Tambayan Facebook platform. So pwede ka magbenta ng goods mo, kukunin ng isang tricycle or habal-habal, tapos ihahatid doon sa from the seller to the buyer. So yun yung ihatod public transport program. Number 4, next slide please. So we made sure there's continuity of public services. We continued operations versus illegal fishing. This allowed us to confidently provide support to additional 1,400 fisher folks that benefited from the rich bounty of our seas. We conducted support to stranded tourists and tourists that opted to stay longer during the lockdown. We had access to medicine. Yung butika sa barangay, through our good mayor, access to medicine for early disease prevention. So, sinuportahan ng medisina yung mga butika sa barangay. In terms of access to education, the LGU, together with our development partner, launched our own modules in English, math, and reading, even in how to become a parent-teacher prior to the opening of DepEd in October 2020. And lastly, we operated the municipality from March to May 24/7 to ensure that we could provide support to our constituency. And the results and outcomes, next slide please. Hello, sir.
Dali lang po, technical difficulties.
Thank you, sir. Next slide, please. In terms of results and outcomes, Del Carmen had the first ever case in Siargao of the COVID virus from a locally stranded individual, but we contained the spread. We never closed our tourism destination and economic activities except na talagang bawal na sinabi ng ITF. We operated the patient transport process for most of the Siargao COVID suspected and positive patients to the city. So we had a process. So kahit anong munisipyo tinatanggap namin, matransport lang sila. We still have, as of today, 0 COVID confirmed deaths. Number 2, part of our results is that we had no reported hunger. We were very serious with this. Weekly, we monitor hunger and crime for early intervention. Furthermore, we were able to manage malnutrition. Even during COVID, napabagsak namin yung aming malnutrition to a more sustainable rate. So, ibig sabihin, maganda yung kinakain ng mga tao. Third, is we were able to open our economy early. DOT and the local government helped the resorts establish themselves as quarantine resorts, allowing entry of tourists for a 14-day initial quarantine, then at least 1 month of stay. So, long-staying tourists. In terms of digital nomads, we work with some resorts and the telco companies to stabilize connectivity and invite freelancers to work and quarantine themselves in Siargao. And in terms of digital marketing, we work with the local stranded tourists and business owners to have vlogs, blogs, and articles about Siargao. So mataas po ang consciousness ng ating tourists when they try to select ano yung destination they want to visit after COVID. 95% of the respondents ng DOT responded to Siargao. This is because of our digital marketing. And number 4, there was a high trust rating for the LGU. So we had good feedback from our stranded tourists, including the embassies. Marami po tayong nagpapasalamat ng mga embahada sa pag-handle ng mga turista nila. Good feedback from the business community sa local communities natin. Magandang feedback sa barangay, and of course from our NGOs and NGA partners. So next slide please. What's our success factor and lessons learned? Number 1, ownership. Act fast, act early. Firm decision of the LGU and the policy implementation. Next po. Tambayayong. This is our Surigao term for coming together. We brought the multi-stakeholders for several discussions using various platforms to allow us to effectively and efficiently discuss how we can link science, innovation, policy, and behavior to manage and govern COVID response. Next po. Is to co-create solutions for hope. Plan consistency of response and recovery early for resource mobilization kasi limited naman ang ating resources. Not only for COVID but also for typhoons. Katatapos lang po ng typhoon season namin from November to February. So we're again planning how long is this pandemic, climate change, and iba pa po. So tuloy-tuloy ang pagpaplano natin at paggawa ng solusyon. So in terms of Siargao, lessons learned in managing the health crisis. Number 1, unified policy through regular dialogue. There's a regular meeting of the LMP Siargao chapter. And of course, a best practice that was revered in the national is the One Caraga Shield. Isa lang po ang response ng buong region, ng Caraga region, covering 5 provinces. Next po. It's the use of technology and innovation. We are monitoring multiple borders. Entry points with the airport in Siargao, in Del Carmen. Our hospital is in the municipality of Dapa. The tourist and in General Luna. So without technology, mahirapan tayo. Next, it's embracing the new normal early. In terms of governance, new normal ordinance, including permanent ICS setup and setup of ICT offices and digitization of services. In terms of social protection, we launched a social protection card for fisher folks and farmers. We promoted community savings groups and investment in community farms. In terms of business, we reviewed the revenue code para mas mapagaan sa ating mga negosyante ngayon. We reviewed the investment incentive code para ganahan naman yung mga negosyante din. And we are now promoting PPP in terms of so that we could reduce the capital expenditure of our investors. In terms of information campaign, we are now balancing hope and reality fairly with the people with the vaccine. So there's continuous consultation with the stakeholders. And moving forward, next slide, please. Our challenges includes vaccination deployment covering 100% of the population. There is a need to continuously review the completed microplan and simulation of the vaccine rollout. Ang Del Carmen po, katatapos lang ng first vaccination of the health workers, and we will do again tomorrow. There is a need to basically improve the projected 3-year 100% target by the national government. Hindi kakayanin yun. Hindi tayo mag-survive. Next, challenge number 2, how to manage hunger with very slow economic recovery. We have to talk about nutrition, about pregnant mothers, about ecosystem support, the current influx of fisher folks in our oceans, other challenges in food security, ASF, avian flu, pest for corn and coconut, etc. So it has to be managed as well. And number 3, consumer and investment confidence. For example, this BPO called Back Siargao was launched as a response to digital nomads as a new industry in Siargao. So we are now fast-tracking the transition as an alternative site for the ICT industry. And we have ongoing setup of the fiber optic cable around the island. We have launched a new tagline, Barefoot ICT and Barefoot BPO. So pwede kang nakapaa. Yun lang po. Last slide. Salamat karadaw sa Ijo Hurot. I hope our experience can inspire and we continue to work together para po sa ikabubuti ng ating bansa. Stay safe. And again, salamat karadaw.
Okay, thank you po, Sir Coro, for sharing with us how to both act fast and early, pero that doesn't mean that you do it haphazardly. You do it with the science-based evidence, even if kulang yung science. Thank you then for also sharing the unified approach, the One Caraga Shield I think is also a very important lesson that we could take away from your presentation. So, in order to move on to our third speaker, ayos lang ulit. And our next speaker po is Mayor from Guimaras, Mayor Ruben B. Corpus. Sir, I give the floor to you.
Okay na? Okay na. Good afternoon, everyone. Good afternoon, Dean Dan, to my fellow speakers, Vice Governor Mailing Quezon, Vice Mayor Alfredo Coro, and of course, Mayor Baby of Del Carmen also, and Vice Governor Maria Carmen Zamora of Davao de Oro. And of course, Ma'am Shelly, how are you? Good afternoon. And everyone who is watching this presentation. I would like to present to you the experience of the municipality of Bordan during the COVID pandemic since March 15, 2020 up to the present. No? But first of all, I'd like to introduce our town. Our town has only 14 barangays with 12,611.2 hectares and a population of 39,372 and a household of 9,013 as of today. Our town is the capital town of the province of Guimaras. It's 1.5 nautical miles from the city of Iloilo, and it's bounded by the municipality of Buena Vista in the northeast, and San Lorenzo on the east side, Sibulag and Valencia in the south, and the Iloilo Strait northwest. No? The municipality serves as the main point of entry to the province of Guimaras, making it a primary agro-industrial commercial growth center of the province. And it's accessible by sea transport, by a pump boat in Ortiz Wharf and the Roro ports, in Roro Port, the Port San Jose, and also in Parola. The pump boat travel time practically is, normally it's 15 minutes, but now it's only 7 minutes. Bordan is the second largest municipality in the island province of Guimaras. Again, the total area of 126 square kilometers, and the topographic characteristic of the municipality is mostly grass domes. That is evident in the numerous caves present in the area. We had lots of caves in the area, and this is followed by rolling hills to very steep slopes, which are usually found in coastal areas facing the city of Iloilo. The municipal waters covers 54.6 square kilometers, and our coastline stretches to 20.6 kilometers and encompasses 15% of the province total coastline. You can see the map where we are. It's very near the city of Iloilo. And on the right side, we are also accessible to the Negros Occidental through the other town of San Lorenzo or Sibulag.
Sir, are you there po? We are experiencing technical difficulties.
Active cases as of today. The municipality of Bordan and together with the province of Guimaras practically We had several situations. We had the ECQ in April 15 to 30, and we had our GCQ in May 1 to 15, and MGCQ from July 1 to July 16, and after that we had the new normal already. During the enhanced community quarantine, we had lots of problems, especially the lack of test kits and laboratories, and there are problems on the access to hospitals and quarantine facilities. In March 21, the Governor Sam Gumarin created an executive order, the creation of COVID task force, which covers the whole province of Guimaras. Every town is represented by the mayors, and that was the start of our strategic direction on how to handle the COVID-19 problem. We had in the executive order for mandatory wearing of face masks and the strict social distancing on public transportation, business establishments, and public places. We also had in the executive order the window hours for business establishments from 5 a.m. to 6 p.m. We did not impose a curfew during the time because the people in Guimaras by 6 o'clock basically are already at home. So nobody goes around after 6 p.m. So as to be able to have a focus on controls during daytime, we only control the window hours for all business establishments. Next. During the quarantine, we had preparation for possible lockdown. We distributed face masks and face shield to all frontliners, and the creation of temporary face shields in partnership with the various volunteer groups, installation of footpaths in ports and the municipal hall, and of course we also have to partner with our stores or establishments for installation of footpaths also, and the simulation exercise of isolating a COVID-19 suspect from the household to our primary quarantine facility. We did that for 1 whole day. And second is distribution of relief goods for the support of our people, and the distribution of dried fish for frontliners, rice, bangus, and pork. The rice is sources locally, as well as the bangus and the pork. This is to enhance economic activity within the area. And also during the ECQ, we did the border screening team. We mobilized our barangay tanods to check on the movement of people, and we did a lot of information dissemination. Almost every day we go around. We have a card to tell people what are the things to be done, and the creation of the COVID-19 response plan for Guimaras, and also the data gathering of residents and the preparation of the quarantine facility other than the primary quarantine facility, which is located at the municipal gym. We also have to talk with the DepEd to use the school facility to be able to use it as a quarantine facility. And of course, we mobilize volunteer groups to be able to help us in the dissemination and control of people going around. And the next step is to purchase more PPEs and vitamins for our frontliners, face shields and other medical needs for all of the the frontliners. No? We also provide free transportation for all frontliners and all employees. We did a 4-day work for the ECQ time. No? And we also did some disinfecting not only the municipal hall, but public places in the town of Bordan. So you can see the pictures there with what we do. Of course, during the general community quarantine, we have a border focus executive order. And executive order liquor ban. No? We had a liquor ban, but it's not effective, no? To have a liquor ban. And ang next thing is since the ITF already loosened the controls of LSIs and repatriates, we did some preparation for the handling of LSIs and repatriates, and the creation of a recovery plan for COVID, and the purchase of RPT tests, and distribution of chickens for the assistance, not only for our frontliners, but for the whole families, the 9,000 households in the town of Bordan. What is the border restrictions? During the process, we had an initiative at the Bordan Wharf, considering that we are an island and considering that Bordan is the main entry. Basically, it contains around 70 to 80% of the entry of people to the province of Mimaras. So we did some initiatives. We had a control of when you get to the province, you have to fill up an SDC. We call it an SDC, and a health declaration card. And we did some matrix to restrict the travel. And we had a number of days to get out and get in. And we have prepared.
Hello, sir. Are you still with us, sir?
As you can see in the pictures that we did it's a Facebook system. Actually, it's very easy, and it's for free. The border restrictions. Just have a picture of the HDC, the health declaration card. You get the name, you get the address, and you can always retrieve that when you want to see if the guy stayed in the province of Guimaras for more than 2 days, 3 days, or more. So it's very easy and it's for free. You don't have to buy some apps which are very expensive. And we were able to monitor the number of people that goes in and out of town, the wharf, from a minimum of 3,000 per day to a maximum of 5,000 per day. No? And during the modified general quarantine, community quarantine, we had the preparation for the normal, and as a bonus, we had the second batch of distribution for chicken as food assistance to all our households, and distribution of Basilis Barangay, and the launching of the Jordan Plant Nursery for our food security plan. Which you can see, we were visited by Sec Nidulo of the Department of Agriculture for us to be able to present the food security plan of the town of Bordan. Because we believe that the solution to stop hunger for our constituents, we have to plant, we have to go back to agriculture. So that's why we decided to focus on agriculture for our future. So the major challenges that we're facing, even up to now, number one is the handling of pregnant COVID-positive patients. No? We had problems with that. No doctor would want to handle a positive pregnant patient. No, the health team refers to facility. So we do a lot of coordination with the hospital, and the hospital sometimes cannot facilitate the problem. No? That's why the town of Bordan prepared for its birthing center in case there's a lockdown and there's a problem with the hospital. We are ready to facilitate to accommodate the pregnant COVID-positive patients. And of course, the second problem right now that we're facing is the shortage of quarantine facilities. No? We have converted our municipal gym as a primary
Sandali lang po. We are experiencing technical difficulties once again. Thank you for your patience, dear participants.
in the municipal hall. No? What we did was we did some temporary suspension of transactions at the municipal hall, and during the process of renewal of business licenses, we did some scheduling of a number of people to come in. We limited the number of people to come in to only 30 to 40 clients per day to ensure that the town of Bordan has only limited people. No? And we did a work week in mass rapid testing. We did strict window transactions only, no? And we also stopped for a short time the plug racing, plug retreat, and the consistent up to now, the consistent disinfection of municipal buildings and other facilities of the town. As you can see, those are the facilities that we did. We did some revisions in our gym to really isolate our patients, and it's quite challenging. No? It's very challenging, especially when people are alone in a primary quarantine facility. It's very, very hard to really secure. So what are the highlights of our recovery plan? No? Right now, since the direction of the town is into food security, we did some distribution of seedlings. We did not distribute seeds because we already had problems with the seed distribution even before. So we have to propagate those seeds and distribute it to the people. And we have a annual mass wedding in the town. Rather than doing it at the town, we did it in the barangay to just continue with our activities. And like I said, the finalization and plan and implementation of our food security plan is very, very important. And we also did some distribution of food packs and potable water supplies in the barangays, no? Going to the households, no? Not only the ordinary people, but we have to direct the households. And as you can see, We have our distribution there. No? It's very challenging. As I've said, it's not easy to really work on it. What are the initiatives for our Northern Mark, considering that we have around 3,000, 5,000 passengers that goes around? At Northern Mark, for inbound, outbound motor bankas, so I phased out of our motor bankas last December 31. We provided tents face mask, not only for the employees, but also the passengers at the wharf. And we also had free pneumonia and flu vaccines for frontliners to make sure that everybody's healthy. So the most important thing here is the partnership with entrepreneurs in the donation of relief goods, alcohol, face masks, face shields, and other disinfectants. And we had a partnership lately in facilitating free classes for LSIs and scholarships for the training of people in the barangay. We bring them to the training center. This is around 20 kilometers from our place. And we bring them there and bring them back just to make sure that they really attend the training programs. So see what we're doing in Tuar, what we've been doing. So that's it. What's the target of the COVID vaccination in the province of Guimaras? We are targeting 70% of the population. For Rodan, that's about 25,000, 26,000. And we prioritize the frontliners and the health workers. And as of now, the frontliners who agreed to be vaccinated went down from 400 to 24. And we had the vaccination simulation with units, and so to make sure that the vaccination is
Sir, pa-unmute po ng mic ninyo.
Okay. Okay.
Can you hear us?
Rinig po. Could you...
Okay. Thank you very much.
Hello po.
Hello po, yes.
Yes po. That was the end of the presentation po.
Thank you po for for giving us your presentation, sir. We appreciated that you mentioned that there could be an agricultural looking approach towards the pandemic. Tapos yun nga po, you have shared with us how very actively involved you and the rest of the LGU was in fighting the COVID response. Sana po ma-meet nyo po yung 70% target for vaccination for everyone. Pati yung health.
Yes. Yes.
Okay po. So now, to give her reaction, share ko lang po yung screen. We have the Vice Governor of Davao de Oro and the VP for Finance for the League of Vice Governors of the Philippines, Vice Governor Maria Carmen S. Zamora. Ma'am, the floor is yours po.
Good afternoon. Good afternoon to everyone participating in this forum. I congratulate our distinguished speakers, my colleague in the Vice Governor's League, Vice Governor Mayling Quezon of the province of Siquijor, Vice Mayor Coro of Del Carmen, Surigao del Norte, and Mayor Corpus of Jordan Guimaras for sharing to us your best practices in COVID-19 crisis management. Indeed, you all exemplify that we are rising to the challenge of pandemic. Based on the three presentations, aside from the fact that I have observed that the three of them come from an LGU where where their LGU is located in an island, which I believe is quite easier to regulate movement compared to our local government unit, like a province like Davao de Oro, which is located along the main Maharlika National Highway, which is also located as a part of the boundary, inter-regional boundary, which for us, it's quite challenging also to be located along National Highway where movement are quite difficult to be regulated. And I also observed that in the presentations earlier presented, most or all of them were presented on the perspective of the executive. As the Vice Governor of the province of Davao de Oro, allow me this afternoon to present my reactions anchoring on the legislative point of view. Allow me to highlight the following points. First, on regulative policies, it must be supported by ordinances. There is a need for an ordinance to support the policies set by the local IATF. One example here is the regulation on curfew. And we believe, in the province, we believe that in order for the barangay captains and the law enforcers to fully implement the policy on curfew, there has to be a backup ordinance. In our case, we enacted a provincial ordinance for purposes of uniformity and easy implementation in the 11 municipalities of the province. The COVID-19 IATF issued a number of guidelines and policies, of which local government units are enjoined to issue necessary executive order or ordinance to effect its implementation. In our experience in Davao de Oro, when giving regulations or restrictions of movement, oftentimes we face the dilemma whether or not the governor or the mayor can impose penalties through executive orders. And to be safe, what the Sanggunian can concretely contribute to the LCE is to legislate the policies and guidelines in a form of an ordinance, especially when there is imposition of fines and penalties. Moreover, Section 468 of the Local Government Code says the Sangguniang Panlalawigan shall review all executive orders promulgated by the component city or municipal mayor within his jurisdiction. In all instances of review, the SP or the Sangguniang Panlalawigan shall ensure that such executive orders are within the powers granted by law and in conformity with provincial, city, or municipal ordinances. They need to closely monitor the ordinances of the Sangguniang Bayan so that the Sangguniang Panlalawigan that can be implemented in the whole province. That is also one of the things that we did to we monitored closely the ordinances of the Sangguniang Bayan. In our case, we saw to it that uniformity and consistency must be adhered, especially in meting out penalties, so that confusion may be avoided. Section 56 of the Local Government Code authorizes the SP to review all the ordinances of the municipalities. Second point, involvement of the members of the legislative body in the local IATF is a good strategy for a wider discussion on policies needed by the LCE. The key to avoiding conflicts is to recognize that the public policies to combat COVID-19 is usually a matter for the legislative body to determine, since the council sets the policy, but it is either the LCE and his department heads that actually see that the policies are implemented. Since the distinction between formulation and implementation is not always clear, open communications between legislators and executives is absolutely necessary. One major challenge in our legislative actions is how to make it as fast as possible without compromising the requirements set by the local government code. Time is of the essence. We cannot afford to waste our time in addressing the required legal authority of the LCE or the review of the municipal ordinances and executive orders. We in Davao de Oro, our SP had to innovate its system to be able to catch up with time. We need to digitize the submission of documents from the municipalities. We have been conducting sessions through Zoom meetings as well as committee meetings and public hearings. We also provide our board members and staff with gadgets just to keep up with the timelines amidst the pandemic. To give you a much more glimpse of what we did in our province, allow me to share our efforts on how we address the pandemic, particularly on the perspective of legislation. The COVID-19 pandemic has prompted the province of Davao de Oro to formulate a government response to protect the health and welfare of our citizens. Here in the province, we have implemented the community-focused response strategy as recommended by the DOH, the Prevent, Detect, Isolate, Test, Treat strategy, which is more focused on the localized response and mitigation of COVID-19 transmission at a community level. The Sangguniang Panlalawigan has enacted legislations to save the downfall of its economy and strategize an efficient public health response. It has also implemented directives and policies through coordination with various government agencies. As a local government unit, we have been on the front lines, supporting first responders, enforce and implement provincial-wide regulations and programs to combat the pandemic's spread and impact. The result of the COVID-19 pandemic is most felt in the community level, while the response and recovery efforts have been the most critical. Our local leaders' role have been vital in determining how well we have responded since the start of this pandemic. On March 16, 2020, the province of Davao de Oro declared a provincial-wide state of calamity, placing the entire province under mandatory community quarantine in all its entry and exit points, and adopted the unified guidelines of the Regional Task Force COVID-19 of Davao Region, headed by Davao City Mayor Sara Duterte. In response, the Sangguniang Panlalawigan of Davao de Oro passed 5 resolutions and enacted 7 ordinances to intensify precautionary and safety measures against the spread of COVID-19. These legislative measures include implementation of a province-wide curfew to restrict movement of people and encourage them to stay at home, enforcement of home quarantine guidelines as a measure to contain, control, and curtail the transmission of virus, regulation of all public transport vehicles to observe social distancing, an imposition of liquor ban, prohibition of unjust discrimination against frontliners, health workers, and those persons who have recovered as COVID patients or those who have tagged as former PUIs and PUMs, and implementation on the mandatory use of face masks and face shield and the observance of public health standards. The imposition of long community quarantines has definitely disrupted the trade and commerce in our economy, resulting to a financial crisis. As this became an upfront challenge to all Davaoenos, this also motivated our provincial sanggunian to create legislations that eases the financial difficulties. These measures include a grant for a 30-day moratorium or suspension on the collection of local payments in banks and cooperatives operating in the province, extension of real property tax payments, a grant for a 30-day moratorium or suspension of payments for water, electricity, and other public utilities operating in the province, and an ordinance prioritizing the local products and or local establishments in all alternative modes of procurement of goods and services by all procuring entity in government within Davao de Oro province. The coordination between the national government and local government is crucial during an emergency response. The province of Davao de Oro has fully utilized and allocated the funding from the national government to respond to the COVID-19 pandemic. This funding has been allocated to support ongoing and unhampered government expenditures and activities in its fight against COVID-19. We have mobilized all our resources to shore up support for our health services and facilities and extended assistance to those who are considered as the most vulnerable to keep them safe and healthy. The provincial task force has been established for effective action. Its structure and functions have been included in the localized COVID-19 pandemic contingency plan led by our Governor J.B. Tyron Uy to effectively coordinate the command and communication systems with other involved government agencies. The province, through PDRRMO, in coordination with lead agency DOH has strengthened surveillance activities through an online system to speed up data collection on confirmed and suspected cases, especially on a municipal and provincial level. Through the initiative of our local chief executive, PDRRMO has taken advantage of the power of social media platforms to raise awareness on public health issues. One of the key roles of the province is to ensure that information reaches its citizens and residents, and this includes the appropriate risk information on measures that people can take to keep themselves and their loved ones safe. Through social media, the provincial government of Davao de Oro has successfully disseminated information on COVID-19 case monitoring, keeping them regularly updated of case counts on the numbers of confirmed positive cases and other relevant information such as COVID-19 hotline numbers and minimum public health standard reminders. In compliance with the directive of various government agencies and joining local government units to implement innovative measures to ensure limited movement of the people and strict observance of social distancing, the provincial government made the following online initiatives to promote commerce and health services, as well as the establishment of an accessible testing facility. As part of the new normal in commerce, the DDO Access to Market Initiative was established through Executive Order number 0050-2020, purposely to ease business transactions, decongest markets, and allow the micro, small, and medium enterprises to thrive despite the threats of pandemic. It is an internet-based business similar to building a physical branch or office, but accessible to a global audience. For MSME, e-commerce gives them the opportunity to promote their products online to attract buyers. A free teleconsulting system, which is an alternative to face-to-face outpatient department medical consultation and is implemented by the 4 provincial hospitals of Davao de Oro, was established to address the need of health services in the province despite the restrictions imposed by the community quarantine. As of March 23, 2021, a total of 16,672 patients were served. As part of our share in the Bayanihan Deal as one grant to the province, the fund was used to build our own molecular laboratory. Last March 5, 2021, we officially opened our own COVID-19 biomolecular laboratory situated at Davao de Oro Provincial Hospital. The laboratory will help us in giving fast results as it will unburden us of transporting the test to nearby testing facilities outside the province. Also, it will serve as a research extension or center. As we lead by example, the province of Davao de Oro has adopted the alternative working scheme of our government employees to further reduce the number of people crowding the offices of the provincial capital and to minimize the threat of COVID-19 exposure to employees with health issues that might compromise their coworkers or clients' well-being and mitigate its impact. Regardless of the adoption of a work-from-home scheme, there is still an urgent need to ensure continuity in the delivery of public service, and this prompts all government officials and employees of the province of Davao de Oro and its municipalities under on-call status to perform their official duties whenever needed. Likewise, electronic conference mode in the conduct of committee hearings, sessions, and conferences in light of the COVID-19 pandemic and minimize its risk. Despite the challenges, the Sangguniang Panlalawigan of Davao de Oro is committed to its mission to promote good governance and enact quality legislation. Aside from COVID-related ordinances, we were able to pass four notable ordinances, such as regulating the use of single-use plastic products, Davao de Oro Zero Defecation Ordinance, an ordinance institutionalizing Davao de Oro Legislative Award, the Purok Omnibus Code of the Province of Davao de Oro. As mass gatherings are prohibited, our innovations to address the public are also modernized. We have made our public hearings possible and wider as we partner with a local radio station and engage in virtual communications like the Purok Omnibus Code, which was just approved last December 14. The public hearing was aired through radio and simultaneously broadcasted via Facebook Live. A consultative briefing was conducted with the vice mayors and SB secretaries within the province, as they were informed that we allow that endorsements of legislative measures and documents to the Sangguniang Panlalawigan office may now be done through its official email. It is an innovation used for faster transmittal of documents and in compliance with existing health restrictions. To ensure that our board members and staff be adept to the intricacies of the new normal of the online sessions, conferences, and meetings, electronic devices and gadgets were provided to them that are suitable with existing applications for easy communication and accessibility. The pandemic did not prevent us to strive best in our pursuit for ISO certification. We are nearing the end of our journey come April of 2021, as the results of the assessment and restructuring of our processes has established improvement in our service delivery. Out of those processes in the provincial government of Davao de Oro, 16 processes come from the legislative branch, the most number of processes in an office to be certified. Past experiences from dealing with SARS, AH1N1, and Ebola virus, among others, would tell us that government intervention through a legislative response coupled with citizen participation mechanisms in response to a crisis will surely mitigate the impact of a public health issue. Transparency and accountability to our citizens keep us in check that resources are used rightfully through corresponding checks and balances to make sure that both the legislative and executive branches of the province of Davao de Oro are responsive to the present needs of our citizens. Rest assured that our local systems are strengthened, as well as the capacity of local government officials to manage policy responses from its people's health, economic status, and overall general welfare. Allow me to end my reaction and presentation by quoting Saint Thomas Aquinas. And to quote, law is nothing other than a certain ordinance of reason for the common good, promulgated by the person who has the care of the community. It is my fervent prayer that as public servants like us, we will continue to become instruments in coming up with policies derived from ordinance of reason for the common good. Whatever roles we may have in the community, we can always be the persons who can help promulgate these ordinances because we all care for the community. Good afternoon, maayong hapon kanatong tanan.
Thank you po, ma'am, for both your reaction and your presentation. So, with that, we have finally arrived po at the open forum. May technical difficulty. So currently we are now in the open forum po, where we will be asking our speakers and our reactor for the questions that you have submitted to us ahead of time and the questions that you've sent to us dito sa chat. So bago po tayo magsimula, magbibigay lang po ako ng protocols and reminders. Uunahin po namin yung mga questions na sinabit ninyo via the registration form. Tapos if you have any additional questions po, again, all you have to do is give us your full name, your institutional affiliation, and type out the question. So, to give po a question from our from the registration form. Ma'am Kristen Diana Galinera, I'm sorry if I pronounced your name wrong, a private citizen from Sorsogon asked, 1. Communication work is especially vital in crisis management. What extra steps did your LGU do to enhance the communications, both internally and externally, during the pandemic? Were there challenges in trying to do this? Tapos the second question is, what sectors were most affected in your LGU and what interventions did you implement to aid such sectors regarding communication po? So anyone po is free to respond if they want.
Hello, sir.
Yes po, sir.
This
Alfredo
is
Coro, please.
Coro. Yes, if I may. Just to give some input, in terms of communication, primary issue was that most of our communication received from the Department of Health and from the national government are either in Tagalog or in English. Considering that a lot of our people in the rural areas do not really have that capacity to understand, we had to translate everything in Surigao noon. And in doing so, we were able to make sure that it's understood. So the flyers, even the messaging services are all in Surigao noon. Second is that we have our community radio. So we use the community radio to regularly remind people of the ever-changing policies we have. We keep on changing our policies, and that's pretty normal in a pandemic. That's like what we are experiencing now. So we have that methodology. Third is that we were able to establish a radio network. So yung yung CV radio, it's all available in all of our barangays. So we use it as well to communicate up to the last mile. So kagaya ng sinabi ko po kanina, we also used other forms and methods, including yung mga naka-speaker, naka-USB lang po, iniikot sa barangay, mapaintindi lang to the last person located in the most upland area, in the most remote islet, para alam nila consistently kung ano yung mga kailangan na dapat sundin para ma-manage tong both the virus and the impacts of the virus to the community. In terms of the sector that's most affected, it has to be our fisher folks and farmers. Not in terms of yung kanilang pangita ng hindi sila makapagtanim, but because of our role is in the supply chain of tourism, humina din yung income nila. So some of them has already moved on to become tourist operators, tourist tour guides, boat guides. So nung nahinto yung tourism industry namin because of the pandemic in Siargao, nag-resort sila balik sa farming and fishing, and a lot of them have to look for the tools that would help them do that. So yun yung intervention na pinasok ng local government, enabling them to plant, buying what they would have produced, allowing market access, continuous market access for the fish and the goods. So similar to what the other rural local governments have done. So it's really opening markets for all these sectors. Yun lang po from our experience.
Thank you, sir. Would anyone else like to answer that question?
Okay.
Yes, good afternoon again to everyone.
Good afternoon, sir.
With regards to the communication, since everyone is now a high-tech situation right now, lahat may cellphone, no? Lahat is into Facebook. So what we did in communication is very basic, no? We opened up a page for the municipality board where they can access lahat ng information na gusto nila. We put up our own executive orders, anong mga place namin, we put it there. Kung anong concerns nila, anong place nila, they put it there, and sinasagot namin through through Facebook, which is faster and which is very easy. So word of mouth, ang bilis ng word of mouth because pagdating sa Facebook, nag-uusap-usap na yung mga kakilala, mga kaibigan, families, and everyone. So it's very simple. It's very simple. You don't have to go around. You don't have to go to people. Just send everything through Facebook through technology. That's what we do in the municipality board.
Okay, thank you, sir. Would anyone else? Baka po, from Davao de Oro, meron po kayong unique communication strategy. Lalo na po na-mention nyo na you employed radio then in your response.
Yes, in the province of Davao de Oro, we, just like with other municipalities, we also employed the use of social media and community radio. Fortunately, almost all of our municipalities also have their community radios. Some local government units also are operating their own community radios. So it was actually easier for us to send all the communication. And again, while at first it was quite challenging, especially on the part of the Sangguniang Panlalawigan, it was quite challenging for us to convince our members or even the Sangguniang Bayan members in the locality to adapt with the new normal way of conducting the session. But after several months, they were able to adjust to it. And now we are actually employing the all means of communication, from internet to radio and to even recorrida. We call it recorrida, where we use motorcycles with speakers. So we use those kind of strategies.
Okay, thank you po. So the next question po comes from Marlon Tagorda, Board Secretary 3 from Ilocos Sur. How effective is it to trade off the productivity of citizens over quarantine protocols? So sa tingin ko po yung tinatanong niya ay, kailangan pa ba balansehin ang health concern sa yung economic concern? Tapos, he follows up with, the quarantined population cannot be mobile and their livelihood and job is much affected because of the protocols that we have. So, ano po yung masasabi niyo tungkol sa effectivity of prioritizing one or the other? Anyone po is free to answer that if they want.
Sir, if I may start again.
Sige po, sige po.
In terms of the prioritization of the economy versus health, ang bottom line naman po niyan is how do you address human food security and insecurity? Kasi ang root ng mga krimen, mag-uuwi yan sa how do you want to support your family, the assurance of your family. So doon lang naman, the decision is really very local. There is no perfect solution. There is no balanced solution that we can all adapt. So from our end, we really had to balance off. There was a need for us to open our tourism early, so that the illegal fishers that became boat operators would not go back to illegal fishing. So we opened the tourism sector as early as June in 2020. Second is, how do you sustain yung supply chain namin? Kasi yung mga produce nila, i-quarantine mo ba sila, yung mga fisher folks and farmers? So we had to open the markets. We had to discuss with the regular market buyers namin what will be our protocol so that we can sustain the economic activity of both sides. One, we could supply you with the fish you would need because wala kayo. The other is that we can also continuously provide this access and income to our fisher folks. At the same time, with the barter model, pwede naman yung pinagbentahan namin ng isda, magbigay din pabalik ng mga supply that we need from the city. So that balancing act cannot really be said na meron tayong best practice. It has to be localized and it has to be communicated regularly. Open communication, open participation, and as the good Vice Governor of Davao de Oro mentioned, there is clear transparency and accountability para alam ng lahat ng sektor how to work collaboratively, especially sa ganitong mga crisis po.
Thank you po, sir. Vice
If I may?
Governor. Yes, sige po, sige po.
Yes,
Hi.
yes,
Yes po. I would
okay. Who's
Sige po,
I would
mauna
like
na po
to
kayo.
share a little bit lang sa regarding the yung balancing the economy and the public safety, public health, di ba? That is a question. Economy and the opening of the economy and basically close. Kasi Siquijor, we had a lockdown for a long period of time talaga. As in, we are one of the strictest in terms of the pasok and strict entry and exit of people. Sa amin naman, we of course we extended assistance, no, meron tayong mga financial assistance, rice, we give cash to the informal sector. Ang ano lang siguro na ginawa namin is basically the provincial government assured the people that as soon as we will be helping the economy recover, that we will go magiging full speed agad kami let's just wait for the vaccine to arrive and ma-protected ang mga tao, and then we will go full speed ahead in terms of promoting the island again in terms of tourism, because the goal, isa sa mga target ni Gov is kung ma-zero COVID kami or low COVID kami, that will be a strong selling point in terms of attracting the tourists, na if you go to Siquijor, you are safe because there's no local transmission, and then very low ang COVID rate. So if you are a tourist and you're going somewhere, you would prefer to go to places na walang prevalence ng COVID, medyo safe ka. So we convinced, we have a very strong collaboration, no, at mga LGUs namin, and then so far naman okay naman yung mga tao, kasi we are also blessed with island kami. We are blessed with buti naman yung island, naka-recover tayo sa I think the slowdown of the tourism, naka-recover yung mga natin beaches and the sea. So back to fishing ang mga tao mostly, and backyard gardening. So we gave seedlings, then yung ginawa ni Mayor kanina, no, na mention niya that we also did that. So basically balancing it, we are parang reassuring our people na let's just get through this pandemic together, and let's just get through this alive and healthy, and we will talk about livelihood and economic recovery after. Let's get through this first, na walang, as much as possible, mamamatay or magkasakit talaga ng COVID, na hindi siya mag-spread sa community, and then the economy will take care of it. The province will take the lead in the economic recovery after. Let's just paano lang muna natin sa Bisaya palabyon parang padaanin muna natin to. Let's ride out the wave first of COVID, and then let's talk about the economic. Parang we were on the trajectory sana na very strong yung tourist talaga namin, pero sabi natin hold muna natin lahat yan, let's take care of our people, and then afterwards let's move forward pag medyo under control na yung COVID sa international, global and national landscape.
Vice Governor Zamora, kayo naman po.
Yes, it was actually a dilemma for all of us, especially for policymakers, to choose between ano bang unahin, ang health or ang livelihood. Parang ganito lang yan eh. May mga tao kaming nagtatanong, buhay nga tayo sa COVID, patay naman tayo sa gutom. So ano bang unahin natin? Pareho naman patay tayo. So anong mas uunahin? But one of the things na siguro mas naging advantage on our part, one of the provinces in Davao region, as I earlier mentioned, that prior to the setting up and activation of the national IATF, we have already mobilized and activated the regional IATF, the whole Davao region IATF. And all local chief executives within Davao region have decided that we cannot impose a policy where we will close our borders from one province to another, because Davao City will be needing the farm produce of our province. Our people also will be needing the industrial needs just to keep our people busy. However, we were able to manage addressing the livelihood of our people, but not to sacrifice and not to jeopardize the safety, the health safety of our people. And so we had to decide that health has to come first within the province, and then slowly we will open the door for livelihood. So what we did in the province, because we are an agricultural province, we at that time our farmers were producing vegetables, we're producing foods, we're producing rice. So what we did, because almost all of the local government units also are into rationing food, giving food packs. So we made it a policy to prioritize the farm produce as part of the food packs, not to prioritize the canned goods, but instead we will give chicken, we will give pork, we will give vegetable that the LGUs bought from our farmers. That was the first step, so that we can also give livelihood to our farmers, and at the same time we can provide food supply good for 2 to 3 weeks for our people, and then tell them to stop moving. We will provide you with food. And so for the first 3 weeks, it was quite easier for us. And then we slowly open the door for economy.
Mayor Ruben, kayo naman po.
Yes, good afternoon po ulit, no? Health and economy, they go hand in hand. Hindi mo pwedeng unahin yung health, hindi mo pwedeng unahin yung economy, no? Experience namin dito, what we did during the early days of the lockdowns, binili namin yung mga baboy ng mga tao dito. So, since bumagsak yung presyo ng baboy, so the LGU bought the mga baboy dito, and then we distributed it to all households. And then we bought dried fish, mga dried fish na mga fisher folks, and also mga bangus. We bought bangus and gave it to the households, no? And considering you have to manage health and economy at the same time, we formulated a long-term food security plan from 2020, 21 to 25. So we formulated a lot of things. We improve our nursery operations, yung mga pangtanim namin. So we started that way back October last year. So ngayon, nag-harvest na kami ng vegetables. We distributed lots of vegetables, mga pinakbet na vegetables. So it's basic, very basic, no? And we bought bagoong at the coastal areas and give it to the households, no? So yung food security plan namin was presented to one of the assistant secretaries, and we asked for intervention from the Department of Agriculture, and we allotted some funds also for the planting materials, no? So far, sa ngayon, people are already reaping the fruits of the food security plan. Yung mga vegetables na asset namin are already sold to the market, and we did not close our market from March until now, no? We did a lot of convincing people to sell their eggs. Lahat ng agricultural produce, ibibenta nila doon sa market. So, hindi kami nagkaroon ng problema, practically. Kung titingnan mo, sa rural area kasi pagka hindi ka magugutom, pagka masipag ka lang, no? As long as your industry lumabas lahat yung mga root crops namin na hindi ka nakain for the last several years, no? Daming root crops na lumabas, na binibenta, at pinamimigay. So, I think yung solution namin na food security plan it's a very effective tool to really arrest the problem on the economy. No?
Thank you, sir. So, isa pa pong magandang question from Geraldine Samson, Assistant Regional Election Director from COMELEC of Butuan City. What public service values must public officials have in order to successfully rise up to the challenge, in your opinions po? What public service values much do we have? So again, feel free po to jump anytime kung may opinion po kayo on this matter.
Example?
Sa tingin niyo po, ano po yung values na dapat meron ang mga public officials in order to successfully?
Here in Nordan, I do leadership example, no? I lead my people, I start everything, and go around. I go around the barangays, no? I bring my Sangguniang Bayan members, I bring my department heads. We go around, we go to the barangays, no? And we talk to the people there, no? Because when you lead them, it's more effective, and you get more information from the people in the barangay, and you get more output if you lead by example. No, that's that's the values that I see. Nagagawa mo yan if there's a problem, no? If there's a problem, not only COVID, we had a problem with the August 3 tragedy, no, lumubog yung pampot namin noong 2019. I was the only one in the province of Guimaras who handled all the problems with regarding to the facing of the people in the province of Guimaras. So I always believe that leadership example is a very good value to become a good public servant.
Thank you, sir. Would anyone else like to give their opinion on this? As a local leader and as a local official, what value should we have in order to rise?
Sir, if I may try.
Of course. Sige po, sir.
As a joiner to sa sinabi ni Mayor, yung sa amin is in our experience is have a leadership framework. The values innate yan sa'yo eh. Kung ano yan, pagkabata mo hanggang pagtanda mo, yan na yun. But have a framework of how you will be engaging with the people. So like a corporate entity, kung meron kang leadership framework, there are many leadership frameworks you can adapt to saan ka most comfortable. The most popular in the Philippines right now is bridging leadership. So that's one we could adapt para alam mo how to handle your stakeholders, alam mo what to expect out of them, what they expect from you. There's full transparency in terms of how you will operate as their leader and as an entity, as a local government entity. Pangalawa po is practice storytelling. Importante, marunong ka magkwento ng ano dapat nilang maramdaman. Kasi pagdating mo sa leadership, importante yung alam mo yung paano ikwento yung storya. Kasi yun yung key. Hindi mo naman ma-reach every person in your locality. Kahit barangay nga, minsan may miss out pa rin si kapitan. Pero if you're a good storyteller, that story will continue to move from one person to another until it would reach every person in the community, and they will start embracing that story to follow the vision that you are espousing. So, yun lang po.
Okay, thank you po. May susunod pa po ba? Going once.
If I may try.
Sige po.
Parang Miss Universe lang ito.
Sige po, ma'am.
Yeah, I agree with both mayors. No, I agree with what they have shared. Siguro lang as an addition, no. Well, lahat naman ng leaders pwedeng maging transparent, pwedeng maging honest, pwedeng maging a leader by example. Siguro lang one of the challenges na mas nakikita ko among mayor and vice mayor or governor and vice governor. Minsan kasi especially if the local government, dun sa local government unit, hindi nagkakasundo ang executive at ang legislative. I think in this crisis, all conflicts have to be set aside, and the value of collaboration have to be given much emphasis. Minsan mahirap din on the part of the vice mayors and vice governors, because in as much as you really would like to step up and help and in the conduct of and in dealing with the pandemic, but we are reminded that we are policymakers. We are reminded na may mas may executive na expected na mag-implement nito para sa lahat. And kung naintindihan lang yon ng every vice mayor and vice governor that our role is different than that of the local chief executive, and that we have to focus on assisting the local chief executive in coming up with policies para mas balanse ang implementation at intervention ng isang local government unit, then I think mas makakatulong ito. We will be able to achieve more. We will be able to deliver more if only we have that in mind, the value of collaboration.
Okay. Ma'am Mailing, sasali po ba kayo sa Miss Universe na sagot? Okay. So, to ask for the last question, kasi the open forum has reached its time. Sandali po kunin ko lang po. How do you think, in your opinion po, na nakisali po kayo sa participation na to, how can we better map best practices to increase collaboration? Kasi yun nga po parang I feel like in order to move past this pandemic, we have to be unified in our responses. Now, we do things in our own locality, but we also have to find ways to coordinate with one another and to better coordinate our response para nga mairaos natin itong sitwasyon natin. So how do you think it would be best? How can we best collaborate better moving forward po? Anytime?
Mayor.
Yes, sir, Ruben. Kayo po, ano?
Yes, basically, based on our experience sa Gimaras kasi, when we had the pandemic, we created a sort of council, no? From the governor to the mayor. So every week we have a meeting, we collaborate, we talk, we discuss about the problems, ano yung pwede namin gawin, ano pwede natin gawin in the future. So yun ang pinaka-the best na ginawa namin. Proper communication, open up, walang pride, wala kang iniisip na mas sikat sa ganito, ganyan, no? We just open up, anong problema natin, what we can do, no? That's why we don't have really big problems for Guimaras, no? When you talk about money, sasabihin ng governor, we will handle the accommodation of the LSIs. The local governments, the mayors will handle the transport of the LSIs and the OFWs. So, importante yung open ang communication natin and open up everything. Huwag mong itatago, dapat itago, no? Kasi press, we have no problem with that, no? So, yun ang nangyari sa aming experience, Gimaras.
Okay po. Sir Coro? Yes po.
Again, tama po yung sinabi ni Mayor and I fully agree with that. It's really about full transparency and collaborating with multi-stakeholders. In our case po, kasi iba po yung scenario namin kasi lalo na nung the time we had to repatriate, we had to deal with like more than 50 embassies because of the tourists. Kasama po sila sa stakeholder na minamanage natin. We have investors that we have to work with. They have their own issues. So it's really about, yun nga, walang tinatago. Lay it down, ipakita mo kung anong kailangan na tulong ng isa't isa. And there are sacrifices we really have to do. We cannot, we cannot win it all. Lalo na sa pandemic na to, there's really a lot of things we have to reevaluate ano yung priorities. Kanina, you talked about economy and health. We haven't talked about family. Importante din yun kasi that's one of the factors we learned when we had to talk to these different stakeholders. lalo na sa mga investors. And in terms of collaboration, yun sana national government would also listen to what the local governments have done. What can we do together in terms of how we can collaborate so that we could make this, vaccine response faster? Sabi nga ni Mayor, he's targeting 70%. Everybody's targeting 70%. But how can we do it effectively, efficiently, now that we are under this second parang semi-lockdown in Metro Manila? And if you lock down Metro Manila, you lock down basically the whole economy of the country. So how do we move forward past that? Yun yung ngayon eh. I mean, how can we collaborate on a bigger scale, on a national scale, using how the local governments have responded, both provincial, municipal, and city level, how we have responded to the pandemic by regularly communicating with our constituency. Yun lang po.
Sir, for your insights. Ma'ams? Meron po ba kayong idadagdag sa nasabi na po?
For Siquijor po, ang ano ko po as collaboration. Actually, ang tingin ko, this is really, the pandemic is really a test of the leadership skills of the leaders, politicians, because you have to work. I believe that one of the hallmark traits of a good politician, good leader, is the ability to get things done regardless of affiliations of those people in the room. Sa Siquijor, there are towns na hindi kalyado ni Gov. We're just fortunate kasi ako tsaka si Gov, we are political allies. Pero there are some towns na hindi allied ni Gov. So what we did is we relied or we sought the help of the technical people. Technical. Kasi hindi naman, this is a medical ano naman to, public health. So we relied, we brought into the picture, we gave a lot of weight on what the medical community has to say. Ano yung mga suggestions nila, recommendations nila, and hindi namin masyadong pinaano yung politics talaga. The political leaders deferred to the recommendations of the medical community. And then si Gov is very, very consensus talaga siya. He gets the consensus of the group and the medical community. And then kung ano yung what's best, even if it's parang maraming pressure talaga sa kanya din politically, pero he does what the medical community is recommending. So, and also we relied also heavily on the interagency, the port authority people, the armed person, uniformed personnel, yung uniform, mga army, police, kasi sa implementation ng mga protocol namin. And then somehow I think in the end, parang it worked. Looking back now, it worked out well. Kasi hindi naman kasi si Gov naman kasi namin, hindi naman politiko by nature talaga. So parang as I've said earlier, we just wanted to keep Siquijor safe, and as long as we have something to eat, and we put on hold the economic growth, but we are ready to pick it up once na mag-stabilize na konti yung health pandemic natin. And I see now, looking everything, very supportive si Gov sa kami, ang province, sa lahat ng request ng national government. So, in terms of may mga request sila, lang talaga si Gov, support lang na kami ng support, kami sa SP. So, when we ask them for help, they also step in. Kasi parang lahat kami nagtutulungan kasi we help each other. Parang meron talagang spirit talaga ng bayanihan. Kasi nga, there's no limit daw to what we can accomplish if we have if we don't mind who the credit goes to, yung sinasabi. So we don't care who the credit goes to. So as long as ano lang natin yung safe lang yung island. So in terms of collaboration, that worked out well kasi si Gov walang very magaling siyang mag-PR dun sa mga national agencies, tsaka yun na nga, we conferred and deferred to the recommendations of the technical personnel. Kasi yung mga technical naman, hindi naman yung sila masyadong politicized. Kasi regular employees, medical personnel, hindi masyado silang politicized. So we set aside politics for this time.
Vice Gov Zamora, gusto niyo po mong chime in?
I already said my piece about collaboration, and I agree with the previous speakers.
Thank you po. And with that ends the open forum. Thank you everyone for giving both your presentation and your wonderful insights during this time. Sa mga questions na hindi po natanong, we will forward the questions to our speakers in case gusto nila mag-respond pa. And with that, dali lang po kunin ko lang yung, I will now be presenting the certificates of appreciation for our speakers who have graciously given us their time to speak to us today. So, from the University of the Philippines National College of Public Administration and Governance, Center for Local and Regional Governance, we award these certificates of appreciations to Vice Governor Mei-Ling M. Quezon from the province of Siquijor for sharing her invaluable knowledge as a resource person during the webinar, Rising to the Challenge of the Pandemic, LGU Best Practices in COVID-19 Crisis Management, 4th edition, held today, March 25, 2021, via Zoom cloud meetings. We also would like to give our appreciation to Vice Mayor Alfredo M. Coro II of the Municipality of Del Carmen, Surigao del Norte, for sharing his valuable insights as a resource speaker, to Mayor Ruben B. Corpus from the Municipality of Jordan Guimaras for also sharing his wonderful insights as a resource speaker during this webinar. And of course, we also would like to give our appreciation to Vice Governor Maria Carmen S. Zamora for her invaluable contribution as a reactor and also as a presenter during this webinar. Nag-double duty nga si Mami. Thank you po for your giving your time. We would also like to thank the League of Vice Governors of the Philippines for its invaluable contribution as an institutional partner for the webinar Rising to the Challenge of the Pandemic today, during this session. Okay, so to formally end po our session, I would like to give our floor to our director, si Professor Alicia B. Celestino, to give her final and closing remarks. Ma'am, you have the floor po.
Okay. Maraming salamat, Gerard. We had a very fruitful discussion, especially itong open forum natin. Ang daming mga magagandang tanong na nasagot na mabuti ng ating mga resource persons. So, we had a very good webinar today and it has to come to an end kahit ito ay very interesting. So I would be closing this webinar briefly. At present, we are actually experiencing unprecedented rise in COVID cases, especially here in Metro Manila. We have not yet flattened the curve, and yet here we are experiencing spikes with a lot of COVID variants. Yung original strain has now mutated and it appears that there is a community transmission, at least here in the National Capital Region. The herd immunity that we are targeting is not yet in sight considering the vaccine issues that we have. So against this backdrop, it is but proper to continue our dialogues, webinars on LGU best practices in COVID-19 crisis management. We are not yet out of the woods, so it would help much if we continue sharing of best practices in the management of the pandemic. We should not let our guards down. All of us, especially the LGUs, who are the first in the line of defense, they should continue to be vigilant, continue to respond to the challenges of the changing face of the pandemic, continue to find ways to protect the health of the people, but as well as to mitigate the socio-economic impact of this pandemic. It's so sad. Imagine there are already suicide cases. nagulat ako. You shared that there are suicide cases in your areas. Akala ko sa mga urban areas lang nangyayari yan. And I hope that suicide cases will not increase as we continue to live in the new normal. So, importante, ma-mitigate natin yung social impact para mabawasan, hindi lang economic impact, social impact din para mabawasan itong mga suicides na mga ganito. Okay, now let me thank our esteemed Vice Governor, Mayor and Vice Mayor who found time to share their best practices with us this afternoon. Definitely, we learned lessons from your varied experiences. All of you came from island provinces and municipalities. Your LGUs are tourist destinations, and we are delighted to know how the LGUs from island provinces are coping with the health crisis. So, maraming salamat, Vice Governor Quezon, to Vice Mayor Coro and Mayor Corpus. Based on what you shared, we can see that you did everything you could to cope with the threats of the pandemic. Especially to Vice Mayor Coro, who was also a former mayor. Congratulations po kasi sinabi mo kanina na as of today, 0 casualty ang iyong LGU. Wala pang namatay na from COVID sa iyong LGU. So you managed to have a 0 casualty. That's a great feat. Congratulations to Vice Governor Quezon and Mayor Corpus, because even in Siquijor and in Guimaras, yung casualties ninyo remain low, and this could be traced to your unrelenting efforts in warding off the COVID virus. Challenges remain though, and one big challenge is reviving the local economy and ensuring food security in your territorial jurisdictions. Saving lives is foremost, but saving the livelihoods of your constituents is likewise crucial. Hence, there is a need to balance the health and economic concerns of this country. Perhaps it would be good if you come up with a solid local economic recovery plan. Marami na kayong nagawa. You started initiatives to revive your economy, and towards this end, I can only wish you good luck and more power. So again, maraming salamat po sa inyong lahat, and we hope to work with you. Should you feel the need to collaborate with us in the near future with your capacity building concern. Finally, on behalf of the National College of Public Administration, I would like to express our gratitude also to Vice Governor Zamora of Davao de Oro for giving your reaction to the presentations and also for sharing the experience of your province in managing the health crisis. Indeed, this enriched our discussions this afternoon. And lastly, salamat po sa mga participants. Salamat po sa inyong lahat for continuing to follow our webinars. So let me also take this opportunity before I end to invite you once more to participate in our upcoming webinars. We have another one on April 5, and this is right after the Holy Week. April 5 webinar will be on the Mandanas ruling of the Supreme Court. So if you are interested, you register and be with us on April 5. And of course, again, before I forget, special thank you pala kay Vice Governor Alfredo Coro. I don't know if you remember me, Vice Governor, pero I've worked with former Governor Sol Matugas. So kindly relay my best regards to former Governor Sol Matugas. So I think this will be all.
Yes, Ma'am Alice.
Gerard, do you have some reminders?
Yes po, ma'am. Pero before po the reminders, thank you po for your closing. May I invite everyone to please open their cameras para may picture taking po. To keep their cameras on for 5 minutes as the staff takes your photo for documentation purposes. And para naman po mapatunayan namin na lahat po tayo ay nag-attend today. So please, open po your cameras and just keep it on. Isipin lang kayo nagsasabi ng cheese, na matagal. Cheese. Ay, sige po. Sandali lang po. We will open the cameras for you. Dali. Sandali lang po. Let me work po the technical difficulties. Sandali lang. Ayun na po. Ayun po. Please open po your cameras now. Thank you, everyone. Okay. Sige po Hold your smile for at least 10 minutes. Hold your smile for 5 minutes po. 1, 2, 3. Cheese. Kung gusto niyo gumalaw-galaw, pwede naman. Okay. Dali lang po. We are taking screenshots po of everyone. So, ito mahirap po Kailangan ko kasi magpatawa para naman nakangiti kayo na matagal. Joke lang. Okay. 1 more minute lang po. Let's hold. And okay. Thank you po everyone for opening your camera and giving us the time and letting us take a screenshot. So, before we go po, magbibigay lang po ako ng mga final reminders para makuha niyo po ang inyong certificates. So, these are for the participants. So, final reminders to get your certification and the presentation materials. Nasaan na po yun? Slideshow from current slide. Okay, last na po. Ayan. Okay. So, next. Participants who have completed 70% of the total webinar time and submitted the feedback form na ililink po namin sa chat box ngayon will receive their certificates of participation and copies of the presentations of the speakers. These certificates will be released beginning April 8 or Thursday, 7 working days after this webinar po, after Holy Week po. So, paantay-antay lang po, medyo matagal po yung process. Please don't forget to take your attendance prior to leaving this webinar po by submitting the feedback form. So, para po sa may QR code, ito po yung QR code para sa feedback. Ito po naman yung link. It's tinyurl.com/LGU4feedback in order to yung feedback form po, nandun din po sa chat. And with that, ayun na po. That was the 4th edition webinar. Thank you again for your faithful participation in this 4th edition webinar. We once again would like to thank the speakers for giving us their time, their energy, and their insights. And we would like to thank them for also being great leaders in their localities and keeping their people and their constituents moving forward as we embrace the new normal. So, maraming salamat po. Also, mentioned po ni Ma'am Lou, please submit the feedback form on or before March 29 by 6 p.m. po. After that, we will be closing the feedback form. God bless and stay safe, everyone po. So, iiwan na po namin yung yung Zoom to be online. So, para makapagsagot po kayo ng feedback ninyo. Okay po. Dali lang po. Okay po. Iiwan lang po namin yung room na nakabukas para sa mga nagsasagot pa rin po ng feedback more. But otherwise, thank you po for joining us this afternoon. Hopefully, we can see you again on April 8th for the second edition of the Mandanas series. Thank you.